Well, hello. My name is Bethany Yeiser. I'm president of the CURESZ Foundation, which stands for Comprehensive Understanding via Research and Education into Schizophrenia. And today I have with me a board certified psychiatrist and CURESZ board member, Craig Chepke. And we're going to talk today a little bit about TD. Dr. Chepke recently wrote an article called TD, a correctable source of injustice, which is coming out in our next CURESZ newsletter in October. And just to begin, Dr. Chepke, could you please tell us a few words about what tardive dyskinesia is?
Sure, Bethany, I'd love to, and thanks so much for having me today.
Mm.
So, tardive dyskinesia is a syndrome that occurs in the context of the use of dopamine blocking medications. Now, that's a pretty wordy statement, so let me unpack that a little bit. So, certain medications block dopamine. Mostly, we think of antipsychotics as being those medications, but some other medications, like some gastrointestinal medications, can as well. And I call it a syndrome, not a side effect, because when someone has a side effect from a medication, if you take the medication away, the side effect goes away.
Uh-huh.
Whereas TD, if someone does come down with TD, unfortunately, it's almost always irreversible, even if the medication that caused it is stopped.
Okay. So tell us what percent of people are developing tardive dyskinesia these days? Is it very rare? Is it relatively common?
Well, so it is categorized by the National Organization for Rare Diseases as a rare disease, given that it affects roughly between 500,000 to 1 million Americans. But to me, that's all too common. About 30% of patients taking the older, typical, we call them antipsychotics or first generation antipsychotics, are believed to have TD, whereas about 4% of patients on the newer atypical or second generation antipsychotics are believed to have TD.
Wow, well, that's amazing. What a difference. Good reason to use second generation and newer antipsychotics. Can you
It is,
tell us?
but one thing actually I would note though that in the past 25 years, the number of prescriptions written for antipsychotics in America has gone up by 4 times. So even though it's 4 times less likely to have TD on the newer agents, then we're prescribing 4 times more of them. So it actually almost cancels out that benefit. So it still is something that clinicians and patients taking antipsychotic medications still need to know about and be vigilant for.
Interesting. Can you describe to us what does tardive dyskinesia look like?
Sure. And as I describe it, I'll try to mimic some of the movements myself from having worked with a number of patients with TD. So TD is a hyperkinetic movement disorder, which means that there are excess movements that the patient doesn't intend to have. So most often these occur in the lower third of the face. So things like the lips,
Mm.
you have like a pursing movement, lip smacking, the jaw can go side to side too, and also the tongue movements. The tongue can dart out or sweep around to the side. And it can affect other parts of the body too. In the hands, you can see what we call piano playing movement. It can cause some swaying in the trunk, and it can affect really any muscle in the body.
Wow. I understand it can also affect the diaphragm, which can be pretty dangerous.
Absolutely, not just the muscles we see, but muscles we can't see can be affected too. As you mentioned, the diaphragm, the esophagus, the soft palate can cause people to unintentionally choke on food and get what we would call medically an aspiration. So it can be very dangerous medically and also a source of falls because the balance is impaired
Wow,
for many people with TD.
interesting. So tardive, I understand, means late.
Mhm.
So these movements often, unlike EPS, they don't show up right away. How long is
Right.
it taking people to develop tardive dyskinesia?
Well, so there's no completely safe amount of time to be on a dopamine blocking medication, but in general, we think of for adults, it takes usually at least about 3 months worth of exposure. But for people over 65, it's actually as short as 1 month.
Oh,
But it often is longer than that. It can be years of use without seeing TD before it develops.
okay. Now I'd like to ask you, why do many physicians not take TD very seriously? And what did you
That's an
mean when you wrote about injustice in your article?
Well, so that's an excellent question, Bethany, and I think it's really unfortunate that I still see this to be the case. Uh, Up until the 1980s, then TD was taken very seriously by clinicians, and there were a number of clinical trials of different medications, supplements to try and help TD, and none of them did very well. And I think there got to be just a sense of frustration that the the clinicians felt they couldn't do anything to help people with TD. And also at the same time, that was around the time when the atypical antipsychotics were introduced, which also brought a new host of potential actual side effects like weight gain, diabetes, cholesterol increases. And those are conditions that we know very well as clinicians how to treat. And so I think it was very tempting and easy to shift our focus away from the movement disorders like TD that we couldn't treat, or at least not treat very well, to a very treatable conditions like diabetes or obesity. So I think that might have also had something to do with it as well. And TD just unfortunately got kind of swept under the rug in my perspective.
So basically, TD wasn't treatable, so people don't talk about it. I'm
Yeah.
thinking, go ahead.
Uh, Sometimes I like to say, if you don't have a hammer, why would you bother looking for nails?
Yeah, good analogy. Good analogy. I had a professional friend who talked about how when he goes to the doctor, he doesn't say, I wish I weren't bald. He doesn't even mention being bald because he knows they can't do anything about it. So they don't talk about it. But I understand
Great
it.
analogy.
Yeah, I understand in 2017, after decades of no treatment, finally we have medications. Can you talk a little bit about that?
Yeah, absolutely. That was incredibly exciting for me personally, professionally, and hopefully the whole field. That there were two medications introduced in 2017 that were FDA approved, valbenazine and deutetrabenazine, that were both very rigorously studied and had really good outcome results for treating TD, and also had very good safety profiles. And both of these medications have been available now for a little over 3 years. And while they're not a cure for TD, they do provide very significant symptomatic relief for most patients who take them.
So are we seeing major changes in people's lives? How do these TD medications change your life, or do they?
So, to me, TD is definitely more than just a movement disorder, that it does have significant consequences. And just to bring up the article, Correctable Source of Injustice, there was a study that was done a couple years ago that looked at some of the functional societal implications of having TD, that they hired actors to mimic the symptoms of mild, moderate TD, kind of like I did just a minute ago, and they taped them reading a script of a job interview. And that the same actor read the same lines without the mimicked tardive dyskinesia, and then did a second take where he did the same script but did mimic those movements. And then they brought a bunch of people together and randomly showed half of them the video without TD and the video with TD. Now, again, this was the same actor reading the same lines with the same expression, except in one take he had TD and in the other he didn't. And there was a huge difference that was statistically significant, where people who saw the video where there were mild, moderate TD mimicked symptoms present, they thought that the person was less likely to be suitable for a public-facing job, less likely to be suitable romantic partners to pursue friendships with, a number of different measures of bias and discrimination that this study was trying to demonstrate. And anecdotally, I've seen that to be true in my patients with TD as well, that they have felt judged, they have felt overlooked, and they felt ignored and marginalized by many parts of society, unfortunately. And with these new medications, it's now correctable,
Mhm.
that we do have medications that are generally safe and effective for people. And so we can change this one thing for many people who suffer from TD.
I remember meeting a woman who was taking valbenazine for her tardive dyskinesia. She was a female pastor, and before she started the medication and as the TD was becoming worse, it looked like she was chewing gum while she was
Mm-hmm.
trying to preach. And her boss at the church came to her and said, "Why were you chewing gum?" And she realized that without TB treatment, she might actually lose her job.
Absolutely. And I've actually met her as well. I don't think I'd ever told you that, but I've met her as well, and
Wow.
a remarkable woman. Yes, there's a number of different people. There's a psychotherapist that I've met who developed TD, and she actually did quit her job. To her, she couldn't think about is what if her clients were staring at her and worried about her, thinking about her movements and being distracted from therapy. So actually, she retired before she was put on deutetrabenazine, and it helped her movements so significantly she was able to go back to work.
So TD can be a debilitating condition, and we have treatments now. And yet sometimes it feels like doctors either don't know or don't care, and they're not taking this seriously. What would you say to these treatment team members and clinicians?
If I'm speaking straight from my heart, it would be shame on you, to be honest, is what I would want to say to them. But that you attract more flies with honey than vinegar. So I think what I would say to them is that I know that probably you were taught that there wasn't much we could do for this, and probably they were also taught that people with TD don't notice it. It doesn't bother them. Those are things that I had heard from instructors in my medical training, some of them at least. And that's definitely not the case. I think that was something that maybe we would have liked to have believed as a medical field, that here's a condition that we really can't do much of anything for, but maybe if it doesn't bother them, it's not so bad that we don't try very hard.
Mm.
I don't know, but now that there are these two treatments, that we've got to change that mindset, that there is a way to help people with TD, and we need to at least give it a try. It's everyone deserves to have their dignity. And I can't change if someone is homeless as a physician. I can't change if they are unemployed. I can't change if they come from an abusive background, if they're being abused currently. But again, with these treatments for TD, now I can give them their dignity back of having control of their body. And I think that it's a moral imperative that we, at the very least, offer these treatments to people who suffer from TD.
And hopefully we can work on getting these treatments to people who suffer from TD as early as possible before the movements become severe, before the movements start to really bother them. So, well, thank you, Dr. Chepke. Thank you for sharing this article again. I look forward to our next conversation.
Likewise, Bethany, have a great day.